Today I'm going to introduce my patient. She's 41 years old, and she has severe injury from the scooter accident. By MRI, she had a complete tear of the ACL and the partial tear of the MCL and the LCL, and also a longitudinal tear on the medial meniscus and lateral meniscus. On next day, so we did the knee arthroscopy for the repair of the ACL and the meniscus. After that, the arthroscopy was successful. Her condition in the knee was fine. At first 2 days with bed rest with the medication for the control the inflammation. Then we do the windbag therapy with the windbag for the recovery process. Has been the 5 weeks after since having knee arthroscopy. Today I'm gonna introduce two things. One, first time is I'm gonna adjust her SI joint, especially sacrum, because patients who had a knee arthroscopy, they're always step with one leg. That's why usually they have subluxation on the sacrum. So I'm gonna do chiropractic manipulation on the sacrum. Then I'm gonna show you how to rehab exercise for her knee, for the isometric exercise. First of them, in her case, most of cases in patients with the knee arthroscopy, they always have a problem with the sacrum. How to check the sacrum is holding the sacrum, and the patient raise your leg, hold it, hold it. So her case is her left side leg is less stronger than the right side. So I will adjust the sacrum so I'll make it even. So Now I'm showing you how to rehab exercise for the knee with the tackle therapy by windbag. I'm setting with RET low beat, low pulse, RET plus, dynamic, low beat, and 30% intensity. So I'm placing two RET node, first one here and second watch is here. Then I place the return plate on the calf. So patient holding the ball for the core. Then first patient just push with the toe, like isometric exercise. Do the 5 times. Then push the whole foot. Now she push the toe with the flexion. So resist extension. You should be careful about her patient's knees deviation or rotation. Do the 10 times. After that, we change to the ball. Repeat the same procedure. First, push with the toe. Then 5 times. Then we do the whole foot. Push. When the patient has holding ball, gym ball for the core, then do 5 times. Do the 10 times with the whole foot. Push. So after finish the exercise with the cool down period, CT and 20%. So after rehab exercise, we need a cool down, so it prevent the inflammation and the swallowing. So just do the 3-minute cool down period. The intensity is supposed to be 20 or 10. So today I'm showing how to adjust the SI joint, especially sacrum, and exercise with the RET plus dynamic with the gym ball and small ball. Then do the 3-minute cool down period, the CT 20%. Thank you very much.